Hello, it's October 10th, it's World Mental Health Day, and the theme this year is prioritising mental health in the workplace. First and foremost, I want to recognise that because we are the Health Service Executive, we're also the provider of mental health services to the public. Mental health services across a whole spectrum of need, adults and children. And I want to recognise all of our staff working in our mental health services today for that continued work they do in putting the public and putting patients first, and finding continuous ways to innovate and to respond to an ever-increasing demand and need beyond the scope of what might be seen to be traditional mental health services. There is thankfully a wider conversation that takes place right across society, and that's around mental health well-being. Of course, health and well-being is a big part of what we also do as a health service. But the theme of today's is to focus on the workplace. And what bigger workplace is there in Ireland other than the Health Service Executive? Some 150,000 people are working in the HSE and our Section 38 partners, and indeed many thousands more in our partners in other sectors like the Section 39 sector, like the private sector and so on. So to everybody who works in or touches off the work of the HSE, I do want to prioritise mental health in the workplace today, October 10th. There's some very useful tips, and our colleagues in HR have produced the 10 tips that can be used by people and indeed by managers to support their staff. Our health and wellbeing team in Healthy Ireland have produced a huge amount of guidance and literature in very user-friendly format about many aspects of health and wellbeing, and you can see these in taking action to support staff in their own personal health and wellbeing. I would encourage you to look out for, to use that material. It is very user-friendly, it is very readable, and the links are available right across our website. But today, for all of the people working in the health service, take time to have the conversation. Take time to have the conversation with colleagues, asking people how they are doing. And sometimes the response to that question being not so good is a very honest response, a very acceptable, a very appropriate response, because it means we can support each other and give support. Thankfully, the stigma associated with mental health conversation is greatly reducing. Still there to some degree, but greatly reduced from what it was. And hopefully will be almost eradicated now in the short few years that are ahead. World Mental Health Day is about the people we serve, but it is also about our staff, the people who provide services. Look after each other. Thank you.